All right, it's the top of the hour, so we'll get started. I'd like to thank everyone for joining us today at GlomCon. Today is part of our clinical trials conference series, which is a joint venture between GlomCon and NephCure. And today's title of our talk and then discussion is IgA nephropathy and FSGS, new insights into the burden of disease and an update on emerging therapies. And part of our partnership with NephCure is to help advance treatment and accelerate research for kidney disease and specifically proteinuric spilling kidney disease. And one of their great resources is their Kidney Health Gateway, which can help patients, family members, and physicians or providers to find ongoing research or trials in their specific kidney diseases in their area and help connect them with specialists. So today, we're excited to have Dr. Bruce Hendry as our speaker. He is the clinical and academic nephrologist and the Europe lead for nephrology at Travere Therapeutics. He is an emeritus professor at King's College in London. He trained in physiology, biophysics, and medicine, as the former head of the Renal Science Laboratory at King's College London and the former president of the UK Renal Association. After his presentation, we'll have a discussion. Two of our panelists joining us today are Professor Jonathan Barrett. He is the Mayer Professor of Renal Medicine at the University of Leicester. Professor Barrett leads the renal research group of IgA nephropathy and the rare disease group lead for the UK National Registry of Rare Diseases. And joining him is Dr. Howard Trackman. He's a pediatric nephrologist who is fellowship trained at Albert Einstein College of Medicine, former chief of the Division of Nephrology at Northwell Health and NYU Langone Health. And he's a current adjunct professor of pediatrics at the University of Michigan and a board member of the Kidney Health Initiative. And Kristen Hood will be joining me today to moderate. So with that, I will turn it over to Dr. Hendry, and he will start our presentation.
Thanks very much indeed, and very grateful to be given the opportunity to present. I work for Travere Therapeutics, and it's a chance for us to present the work that we're doing in the need of improved care for patients with rare kidney disease. I'm going to start sharing my screen. So I'm hoping you can now see that clearly. Can you do that, dear?
Yes, looks fantastic. Good.
I've got a couple of ups and downs with internet connection. I have a plan B, but if I do disappear, then dear, if you could give me a quick heads up, that would be great.
Yes, of course.
So thanks for giving the chance for Travere to present today, and I'm delighted to be taking that role. Our mission as a company is to improve the care and lives of patients with rare kidney disease. And I want to start with two facts about us. One is that we're very patient-centric, and the second is that we're collaborative. And these linked together very closely. We're collaborating with NephCure, with GlomCon, with Neptune, with multiple academic centers, and with commercial partners worldwide. And our mission is not accomplishable unless we collaborate. So we really value these collaborations extremely highly. In the first part of my talk, I'm going to illustrate the collaborations we have with three examples where we see data emerging. They're going to be quite high level, and I'm going to try to create a sense of what we're doing and the direction of travel, rather than going deeply into the data as it emerges. In the second part of the talk, I'm going to give an update on the sparsentan clinical development program, and I'll preface that with an overview of where we are with phase 3 studies in these two diseases, IgA nephropathy and FSGS, to give a sense of a landscape. But beyond that, in talking about sparsentan, this talk will be unbalanced because I'm really going to talk about what Travere are doing. And I think that's appropriate in a clinical trials seminar setting. A big disclaimer to begin with, sparsentan is an investigational agent. It's not licensed in any landscape or domain. And so I'm talking about it to clinical trial interested experts academically, and in no way encouraging its use before or without license and label. So here's an update and a sense of what the talk will look like. I'll talk about the burden of disease using examples from three collaborations with which Travere are working. RADAR registries in the UK, the Optum collaboration in the United States, and a collaboration with USRDS. And I'll then talk about emerging therapies and focus on the sparsentan program. So to begin with RaDaR, we have a really privileged situation where we're working closely with the UK RaDaR registries. They are rare disease registries based in the Renal Registry in Bristol and with a national collaboration and national catchment. And this is an example of the data emerging from our work with the IgA RaDaR registry. And you can see here a renal survival probability as a function of follow-up time in adults in blue and in pediatric patients with IgA in the red. And this data set is now being analyzed in some detail to provide some really useful insights into the